And so I think for certain people, the possibility of living a lot longer is quite great. The question just becomes is how broadly distributed will that privilege be? Who was the CEO of Chrysler, said that the biggest expense in his cars wasn't steel, it was healthcare.
All right. Brenden, thank you so much for making the
My
time.
pleasure. Good to be here.
Yeah, so maybe tell us about your background and what you're focusing on at the moment.
So I've been in sales for a long time, always B2B kind of enterprise sales. And over the last 10 years, I've been doing a lot more consulting to tech companies around sales, helping them with their sales strategy and execution and that sort of thing. And now I'm doing more these days, coaching founders and startups, very early stage companies, and kind of helping them with their sales, because I can make more of an impact, and it's fun. And I think in a lot of cases, I think founders really need to be selling, but they need to know how to do it better, and I kind of help them with that. So that's what I've been doing.
Mm-hmm, mm-hmm. And before, you were spending a lot of time in healthcare, right? That was like the main sector you've been in, right?
Most recently, yeah. So I used to be was in telecom for a long time, selling to AT&T Bell Labs, and then in financial services on Wall Street, selling to Wall Street. And now I've been most recently for the last 15 or so years selling into healthcare companies. Yeah.
Yeah. And what specifically have you been selling healthcare wise?
So in healthcare, my consulting work is largely with companies that have a patient-facing or physician-facing solution. So, doctors are using something, or the patients are using something, or they're using something to engage those two groups. But my customers typically in those situations would be academic medical centers or health plans. And then in addition to that, I'm co-founder of a company called Expertscape that identifies and objectively ranks medical experts by specific topic. And so it uses PubMed to find and kind of quantify the people that have published the most on very specific topics, over 29,000 different topics. And so those customers for Expertscape, they're pretty much academic medical centers today, and pharmaceutical companies.
All right. You already said a bunch of like juicy stuff that I want to dig into there. Sure. So you said your customers are or have been kind of like healthcare plans.
Yeah.
The other day, because I'm considering a move to the US, I was looking into how much I'd have to pay for healthcare in the US.
Yes. Yeah.
And it's ridiculous.
Oh, it's crazy. It's insane. The good thing for you is you're relatively young, so it's cheaper still for you, but it's still crazy expensive. And in fact, jumping right in here, I view this as a real disadvantage for entrepreneurism in the US, because if you want to go off and start a company, you need, I don't know, $24,000, $36,000 right up front every year to cover your health insurance expenses right out of the gate. And that's not something that European countries, people in Europe don't typically have that same problem. Healthcare is usually kind of bundled in. And as a result, people have a lot more opportunity to go off and start a new thing. Whereas in the US, it's a sizable chunk of income.
Yeah. And so what, basically, I think it's fair to say that this system is very messed up.
Yeah.
And
that's a way to put it.
Like basically what can we do to fix it? And what maybe over the next 5 to 10 years could happen, or maybe is happening already since you're so deep in the space. Maybe tell us about it.
Well, let's first start with the fact how absolutely complex it is in the U.S. in the sense that our economic model is very different from the rest of the world in most cases, and that is, it's very much a a profit-based economic model in the U.S. Right? And so, and the consequence of that is huge. In the GDP, healthcare is at least 17% of GDP right now, and heading very quickly towards 20. And at some point, it's going to collapse our economy because it's just an enormous tax on every other business in the country. I mean, a long time ago, Lee Iacocca, who was the CEO of Chrysler, said that the biggest expense in his cars wasn't steel, it was healthcare. And so if you drive that through to the rest of the American economy in itself, if healthcare is 17 or 18 or 19% of GDP, and it's 7 or 8 or 9 or 10% for Germany or Japan, then just use those two countries as examples, then the cost of a car coming into this country can be significantly less and be just as, and be priced properly, but priced competitively. And consequently, when we ship things overseas, we're dealing with a healthcare expense burdened into the product that's twice what it is for any other country. And so that's an economic problem for us as a country. Now, it gets complicated in a lot of ways in the US because we're a profit-based economic model. But the problem is because 17, 18% of the GDP is healthcare, you can't just lop that out of the cost of care because it affects 17, 18% of the economy. And so all of a sudden, when literally 1/6 or 1/7 of the economy is healthcare, you can't just chop that out because there are just millions of jobs and millions of companies that are at that trough, if you will. So it's a complicated problem.
Yeah. And it's one of those. No, sorry.
I was going to say, and I haven't even begun. I don't even know that that's easy a way to solve it. But at some point, we need to figure out some way to take a lot of the inefficiencies out of the process. I mean, just in terms of processing claims and who's involved and providing more competition rather than less. I mean, a lot of healthcare is consolidating around large players. And a consequence of that is there's not a lot of incentive for competition in a given market. In many markets in the US, there are 1 or 2 large health systems that dominate the market. And consequently, there's no competitive pricing pressure on those institutions. They basically say, hey, these are our costs, pay them or not. And a health insurance company has to basically pay those costs because the consequence of that is they can't otherwise deliver care to their customers won't be able to go to those institutions. That's I'm still not solving the problem though.
No. And like I'm obviously hopeful that technology, like we're seeing this rise of telemedicine now with COVID. So I'm hopeful that technology can take out some of the inefficiencies. Yeah.
Well, and telemedicine is the pandemic in a very interesting way has accelerated that adoption rather dramatically in the US. I mean, a lot of the walls have come down between states in terms of delivering care. The acceptability of doing things over video has gone way up, and the infrastructure around that has started to really develop. And reimbursement around those things in the US, that's a big deal. Reimbursement for telemedicine consults has become much more normalized. And those things are all going to work to accelerate that as the care delivery mechanism. And so I think you'll definitely see improvements there as a result of that.
I guess the question is like, will those cost savings get passed on to the customer, like that the B2, the actual person at the end, not like some element in the chain, just like increasing margins.
Yeah, and I guess some of what we have to hope to see isn't so much that the cost will come dramatically down, but that curve will flatten. And there, I mean, there's probably an argument to be made that a company, that the country can tolerate 17% GDP. We seem to have been able to do that so far for healthcare expense, but there is a breaking point, and if we can kind of curve that, bend that curve downwards even a little bit, is a phenomenal would be a phenomenal accomplishment. And we've done it before. We did it back in, I guess it was in the 80s, when we went to this HMO model and so forth. And we did actually reduce healthcare costs significantly, but only temporarily.
But then what happened? What happened?
Well, because I think this is a long conversation, but I think a lot of it had to do with the kind of the complexity of our system, and we had gone to this HMO based kind of model in particular, where you didn't have much choice. You were inside of a you could only really go to certain healthcare professionals, and Americans love choice, and they love immediate gratification. And so if you want to be able to go to your doctor, and not just any doctor, you want to be able to go to your doctor now. And so those things, the old healthcare system back in the 80s didn't accomplish that. I mean, it kind of prevented that, and there was a kind of reaction, and new offers came out, and consequently we're back to this climbing pricing.
Because like I would think after a certain point, a lot of middle class folks will just say, I'm not gonna spend whatever, like $25,000, $35,000 dollars a year on healthcare. I'm just gonna like opt out and not have insurance at some point,
Right.
And then that's just gonna like have such massive ripple effects down the line, because then something simple like breaking an arm can like make you unable to work, and then you lose your job, and then like you're in poverty.
Right. Well, I mean, in the U.S., typically it's typical that if you work for a company, that company provides some level of health insurance, and so the costs are not nearly as onerous as they would be for someone that's unemployed or self-employed. So if as long as you're holding down a job, there's a decent chance that you've got health insurance of some sort. And so those people aren't the ones that, I mean, it's still expensive, but they're probably protected from a catastrophic outcome.
Yeah.
But there's a sizable percentage of people in the U.S. that are not insured or are or dramatically underinsured, and that burden, ultimately, that cost burden, comes back to hospitals. It comes back to the U.S. government, and because someone ends up paying that bill, either it's charity care or it's written off or what have you, but that cost is borne by somebody.
Yeah. I know on a yeah, this is a bit bumming me out.
Yeah. Well, I'm sorry, but it's kind of, and it is fascinating. I was thinking about this the other day. This is actually probably exacerbated by the whole VC kind of funding. I'm going to make no friends when I say this, but within the VC community.
Oh, let's hear this.
But there's a strong argument to say, if you're an entrepreneur and you've got a decent idea, you want to go out and get VC funding, because the VC funding in part helps you finance the very health insurance that you need to staff your team, to staff your company. And if you get a check for $500,000, it's probably to do some product development, but it's probably also to recruit people and pay salaries. And the fundamental component of salaries is having health insurance. If you didn't have that burden, that health insurance burden, you might be able to bootstrap for a lot longer. I haven't thought that all the way through, but I mean, that is an incentive to go out and get funding.
Yeah, I mean, it really is, because you need to cap your downside.
Yeah.
Yeah, because then I don't know, I'm just thinking, because like on the other hand, sure, in, according to that logic, in Europe and whatever, Germany, you have a much
Yeah,
better, startup friendly environment.
yeah. Well,
However,
at least from that, from a healthcare standpoint, yeah,
yes,
that's certainly
yes.
true. Yes,
Oh,
yeah,
certainly from this, healthcare standpoint,
yeah,
yet you don't have nearly as much startup activity here. So it clearly is some kind of mentality mindset
yeah,
thing.
yeah,
And
yeah,
this is not, enough of a deterrent that, like, I mean, clearly you have to be crazy in the first place to, start
yeah,
a
yeah, yeah,
company.
yeah, yeah.
um but just interesting, the different, it has to be some kind of cultural mindset thing.
Yeah, historically, I think that's probably true. I mean, the U.S. has this kind of Wild West mentality that because of our, our culture and so forth. They really do celebrate the renegade and the iconoclasts, and much more so than I think other countries do. We value money the way European cultures tend to value education in a lot
Mm.
of cases, right? I mean, education in Europe, in my experience, is that's a signal. Whereas in the U.S., a very strong signal is your income, your financial status. Um, so, but I think that's changing. I think it's starting to change. I see a lot more activity. The Y Combinator crowd, they're now actively um, out there and looking for startups in other parts of the world and having huge success. I think in terms of identifying entrepreneurism, elsewhere in the world. So I think that there are certainly advantages in the U.S. and there's certainly a cultural mindset in the U.S. But I think other countries are starting to really kind of pick up on it. Is that
Yeah,
would you say the same?
yeah, I would say it definitely, it's starting to get more broad as far as like, like kind of like, they're saying like kind of like Silicon Valley finally is starting to go
Yeah,
remote.
yeah,
um yeah, I would say so. Though, it remains to be seen whether we'll see this massive decentralization, or it's just like a bit,
yeah,
a bit extra sort of,
yeah.
here and there.
Right. Yeah, yeah.
Mm.
It's well, I mean, you're certainly hearing about this exodus out of Silicon Valley to places like Miami and Austin and elsewhere. And there's a strong argument that says, boy, you can do a lot of this stuff online, and you don't have to be in close proximity to people. And I wonder what's going to happen with real estate and these offices going away, at least in some regard. I mean, there seem to be a number of companies that have decided, oh, you know what, we're not going to have a huge corporate footprint anymore, and people are going to work from home. And, they'll come in once in a while for meetings and so forth, but you're going to do a lot more things remotely and virtually. And if that's the case, is that not also true for Silicon Valley?
Yeah, for sure. I'm still, it's still unclear with commercial real estate. I think there's certain, like for instance, warehouses, that's going to be a big thing obviously going forward with all the e-commerce, so that's
Yeah,
fairly safe. But sure, if you're talking offices,
yeah,
is difficult. um yeah.
yeah. I have way more conversations with people in Europe than I do with people in Baltimore now, for
Mhm,
example, because
mhm.
just of the nature of the pandemic and Zoom and so forth. And I wrote a book about sales, and a long time ago, I started using video way before the pandemic. I was using video calls, so I'm kind of quite accustomed to it. But I mean, I think everybody is now. I mean, it's quite normal to have a video call, and I have them all the time now. I don't know that it's necessary to go into the office every day.
No, no. Like the one thing I'm concerned about is this almost like fetishization of, is that even a word, of this
Yeah,
remote,
yeah,
lifestyle. Um to the point, where hard tech startups, hardware startups,
yeah,
solid like
yeah,
making things is being
yeah,
looked down upon because, you can't be in the cloud, you can't, work from the beach,
yeah,
and because the world needs that too. a lot, actually, everything to do with energy, climate, like that's all like very much hard tech where you need to be there physically in person because you're making an actual tangible thing.
Yeah.
And I'm just like, because like the new, I don't know, American dream almost seems to be like this. Yeah, I want to like, work from anywhere and ideally have my software business in the cloud. And like, but with those hard things, you can't, like, because they're actual physically there.
Yeah.
So I hope that, the smart kids, that, I don't know, but then even it's like, on the other hand, you have, it's getting so expensive. It's getting so expensive even in the secondary hubs. And then the question is like, where do the kids go? Because like back when all the hardware startups started, for instance, Silicon Valley, it was dirt cheap in comparison to now.
Yeah. Well, I mean, but in some ways, real estate costs are, well, this is a kind of definitely an inflection point, because now we're seeing all sorts of different weird behaviors with real estate in particular, like prices in homes in Silicon Valley are arguably maybe going down. I don't know, but like manufacturing, the cost to do manufacturing is in a lot of cases going way down. So there, theoretically, there will be a lot more manufacturing. I remember a long time ago reading about how Intel, used to have real difficult, creating a chip factory used to be a really big investment, and it's gotten much, much simpler and smaller, and now much more portable. And so you can actually start a chip company, much less expensively than it used to be. And certainly you're seeing like 3D printers and other tools that are making manufacturing cheaper and smaller. And so I think there's, it'll be interesting to see how that all plays out. And a lot more of that will be automated. My son works at Tesla in the factory, and it's all robots, which is a whole nother topic. We could get into AI and robots and that, but
yeah, I'm just like, because Tesla famously started building this factory near Berlin, Germany, where I live. And it was this this huge thing because because obviously Tesla is very sort of like zeitgeisty.
Certainly.
No, but speaking of Germany, so it seems to me like the German healthcare system must be excellent, because a lot of foreign leaders, a lot of high-level people continuously come into Germany for medical treatments.
Yeah. I know. I actually know something about that, because Expertscape identifies, as I said, medical experts by using PubMed. And Germany has a very strong, scientific and medical, infrastructure. And I'll tell you a kind of funny story, kind of a completely ad hoc, but I had a aortic valve replacement last October. So I had a open heart surgery. And as a consequence of that, I was, or actually building up to that, I had gotten an email from a guy in Martin in Germany. And he had mentioned to me that he had some questions about his ranking in our system in Expertscape. And I wrote him back and said, "Oh, man, you're an expert in all these areas, in the top 1/10 of 1% in the world in certain things, including," I wrote to him, "the very thing that I have, that I'm suffering from, which is aortic valve. I had a bad aortic valve." And I wrote him, and he said, "Oh, well, by all means, you keep me apprised. Let me know how it goes." So I'd send him my echocardiogram results, and he'd read them he'd read them and then diagnose them and then send them back to me. And then I got an MRI, and I asked them at the MRI, I asked MRI folks, could I get a copy of "Oh yeah, we'll burn you a disc." And they did. They hand me a disc, and I put that in the cloud, and I sent it to him. And he diagnosed the whole thing. He said, "Oh, you're going to need this, blah, blah, blah. You're going to need this valve." And, he even gave me the brand of the valve, and this is in Germany. So I had, I went in and see my doctor knowing everything I needed to know about having an aortic valve replacement. And that's going to be available to everybody at some point. And this kind of brings up a kind of a fascinating thing, and that is that I believe that there's this move towards an expert economy. And so, because of the virtual nature of the internet and access to physicians like Martin, now you can go and you can consult with the very most knowledgeable people in the whole world on a topic. And ultimately, he didn't charge me, but he ostensibly could have. And so, a lot more people are going to have access to German physicians, for example, that are the best in the world, or American physicians at Johns Hopkins, who are among the best in the world in many areas. And so that, this going back to this whole telemedicine thing, people are going to be able to access really talented individuals. And it's going to be interesting to see how that plays out for everyone else.
Yeah. Oh, 100%, especially since, like you said, it's so much more scalable too, because,
yeah,
you can, and also, obviously economics 101, like Mr. Specialist can charge probably thousands.
Absolutely.
Because people will happily, pay. And
yeah,
it's also, bringing almost like making it more accessible, because maybe until recently it was only the I don't know, president of some African country that could, fly out to Germany in his private jet.
Yeah.
And now it's like a middle-class American that can just hop on Zoom.
Yeah, right, exactly. And it used to be that, Martin could only see someone that was within, a couple hundred kilometers of his hospital, perhaps. But now, ostensibly, you can see anyone on the globe as long as they have an internet connection, and he can diagnose them. You send files back and forth. And he obviously can't yet perform the surgery, but that day is not that far away either. I mean, I think they did a robotic surgery for someone in Antarctica, right? They had someone that was sick in Antarctica, and they did a robotic surgery based on, someone elsewhere in the world. So, those days are coming.
Man, that's crazy.
Yeah.
That's actually crazy. Like a remote controlled surgical robot.
Yeah, they do robotic hip and knee replacements now, hip in particular, where the surgeon operates from a terminal effectively, and you're going to see more and more of that in the future. I think, and those sorts of things are going to happen. I can't remember the fellow his name now, but he's I will eventually. But they're now talking about pills that you take that have chips in them, and then they run through your body, and they record various readings as they run through your digestive system, and then they spit out the data, and you've got a whole analysis of your you've got a diagnostic system that just in the form of a pill.
Is that
pill.
Have they made that already?
They're working on that. That's certainly developed. I don't know if it's been through the FDA and so forth, but it's certainly
Wow.
And those things are, now you can get all sorts of diagnostic tests for cardiology, so that you can have a remote diagnostic consult with a cardiologist based upon some apps and devices that you can now get that are FDA approved. So I mean, healthcare is definitely a lot of interesting things are going to happen with healthcare.
Do you think? Yeah. Oh, for sure. Yeah. No, definitely. Do you think the other side of the coin? Do you think people are going to live much longer as a result?
Oh, no, certain people, no question. No, I mean, there's a whole bunch of effort, and there's some real very significant investments and attention being placed on longevity. And there's Ray Kurzweil is the guy that kind of started it all with the singularity, and his, I don't know if he started, but he certainly has made that. Peter Diamandis talks about living to be 700, and so I think for certain people, the possibility of living a lot longer is quite great. The question just becomes is how broadly distributed will that privilege be? You know, as in most things, especially in the U.S., things aren't equally distributed. So, we have among first world countries, we have one of the worst records for infant mortality right now, and I think we're below Cuba, and in terms of infant mortality, but it's very much skewed towards based on financial, by economic factors. So and I'm pretty certain the same will be true in terms of longevity, right now. In fact, I would argue that there's a whole bunch of very interesting stories, sci-fi stories that you could write about longevity and how it's going to play out, so.
Oh yeah, that's fascinating to me also, how, sci-fi, it's sort of like science fiction writers that made up the future. Yeah. And then, it's like nerds that get hooked on that. And then they actually decide to build that. And then that becomes reality.
Yeah. Well, there are two movies that like this, we're going off really off on a tangent, but two movies that I think are really prescient in that regard are Ex Machina, and he builds robots and that have artificial intelligence and are learning machines, and Her, which the one with Scarlett Johansson and Phoenix, what's his name, Joaquin Phoenix. Those two movies, I think, are so telling about where the future is going, and I wonder if they're not cautionary tales. So I don't wonder, they're cautionary tales. So, but from a science fiction standpoint, they're very forward thinking, but at the same time, I think they're very predictive.
Yeah. I heard this the other day. I was listening to this technology guy, technologist, Balaji something.
Oh yeah, I have to listen to that. This is the Tim Ferriss interview.
Yes.
It's queued up on my. I would have hoped to listen to it today. Yeah, it's supposed to be fantastic.
Oh yeah. And no, he was saying something along the lines of like, if the goal of technology is to remove scarcity, then the ultimate goal of technology is to make people live forever.
Yeah. That's a big philosophical question, though. I mean, what happens when there's no end, right? What do you do at that point? We're going off in a distance now, but I mean, what happens if there's no end? I mean, humanity has always been, focused on, preoccupied with the end, and what happens when there is no end? And there's the possibility that it just goes on and on. That's fascinating to me.
And even if that's just a kind of like marketing speak to get people hooked on longevity, even if, let's just say hypothetically, you get the life expectancy, you get it up to, I don't know, 300, right? That's still a lot. That's a lot.
Yeah, are you kidding? Oh,
yeah, that's crazy. And then there's so many questions, right? Do people then will they put off a lot of stuff until tomorrow? Will they maybe get tired of life? And maybe some people will say at 120, I've had enough. Or will people at 300 want to, extend life to the point that they can live, all the way to 500? So many questions.
Yeah. I don't know. That's so wild. First of all, I maybe I'm pessimistic here, but I don't think that that's something that's going to be broadly distributed in my lifetime. Like I don't think most people of my age will be living to be 200 or even 150. I think, I think the likelihood of making it to 100 is greater and greater if you're in a certain economic threshold. But I don't know that 200 is, or even 150, because we still are breaking down faster than science is able to put us back together.
Exactly. And there's a lot of, unsolved bottlenecks still, like, the brain, as far as, Alzheimer's, dementia.
Yeah.
And then it's, of course, kind of like replacing broken parts, quote unquote.
Yeah. Yeah. I think there's a lot of, there's going to be innovation in particular around fixing things that are broken. More so than figuring out how to keep them from breaking in the first place, at least for the time being. But it does. I don't know. It'll be interesting. And then the ultimate question then becomes how. Well, there are lots of ultimate questions, but one of them would be how much can the planet sustain if all of a sudden, or over some period of time, the whole population, or a big chunk of the population, is now living 3 times as long as they were supposed to.
Yeah, that's a big question.
Yeah. So
that's a big one.
Yeah.
Let me
a lot to chew on.
Yeah. Like, oh man. Let me maybe like switch gears a little.
Sure.
And ask about, again, just a little, because it's tangentially related. What is your take on sort of like the next 10, 20 years as far as, the prosperity of the world? Are you very bullish on Europe, because you seem very pro-Europe? Are you more bullish on the US? Are you on Asia? How do you see the next, 10 to 20 years sort of like map out?
Yeah, that's an excellent question, because the one thing I found, one particular rule of thumb is it being negative, having a fixed mindset almost never works out to your advantage. Somehow or another, having a growth mindset tends to be, you get rewarded for having a growth mindset in most cases. So it's easy to be a little bit, it's easy to be negative about certain aspects about where things are going. But number one, I guess, is it's generally speaking a bad idea to bet against the United States on economic matters and so forth. So I think that's I think the U.S. will continue to do well. I think that the Europe seems to be doing will be a good environment because of what's, I think some of the things that are happening there. I think Asia is really ascendant. China is the big question mark right now. I mean, I think they have the potential to be just enormous, and in some ways really scary, in the sense that they're just well, they're not a democracy. So as a society, they're very buckled down, and they're doing some really kind of troubling things in terms of surveillance and oppression, electronic oppression. So it remains to be seen how China's going to play. And I think in that interview, the Tim Ferriss interview, doesn't he predict that there'll be a war between China and the U.S.?
I haven't come that far if he does, because it's
Okay.
like a 2-hour interview.
Yeah, I know. So I think that's a troubling prediction right there, because that's not an outcome that I think anybody wants. So I guess I'm bullish, because it doesn't pay not to be.
Yeah.
But we have some big challenges ahead of us, environmentally in particular, and I think in the U.S. it's income inequality is really working against the society as a whole, and healthcare, as we talked about, and our political system, our media system is really kind of broken right now, and it'll be interesting to see if we can kind of get it on a better footing.
Yeah, like So I'm half Russian. My dad's from Russia. And so I like to talk a lot about, I like to talk to a lot of Russians to, my
Yeah,
family there, just,
sure.
what's going on, tell me. And so they're all saying the same, that everyone smart and capable ends up leaving the country as soon as they can.
Yeah,
Because of, Russia and China are quite similar in
yeah,
their, as far as like, oppression, freedom of
yeah.
speech,
Right,
etc.
right. Mhm.
Um, but also economically, you have to be very well connected to begin with
Yeah,
to get somewhere. It's not
yeah,
like, in the US, it truly does seem like, if you're from, the middle of nowhere and, maybe someone will bet on you.
yeah.
But, in Russia, this really doesn't seem to be the case unless
Right.
you
Right.
are well connected.
Yeah,
And again, obviously, I don't know anyone really from China.
yeah,
So, but I would imagine that, it's quite similar in that Chinese people are trying to, get out of China
yeah,
into a
yeah.
more free society.
Right. I think it's
And
yeah,
and I think as long as that's true, as long as Chinese people, as long as the elites, quote unquote, the smart people
yeah,
are leaving,
yeah.
China will not be number one.
Right. I don't know. I mean, yeah, maybe. I don't worry particularly about Russia. Russia's a kleptocracy for all practical
Mm,
purposes, and I don't think I think it's basically in place to take advantage of, for a very small subset of people. And it's I don't know about China because because they make it so difficult for so many people to leave,
mm,
and where are they going to go
mm.
if they, just given the size of that population. I wonder uh, what might happen, especially given the fact that they do so much to inform their population of a certain mindset. They control the channels of information, I think, to a much greater degree than we do in the U.S.
Mm.
Of course, although we've got our own media issues, as I already mentioned. So I think it's going to be. I think they're very formidable.
Yeah.
I wonder, in fact, I wonder if in some ways this, we're in the process of, there's 1.7 trillion that is now being spent because of the pandemic to kind of help people out. And then there's another 3 billion that they're contemplating here to spend. And that's a lot of debt for this country. And I sort of wonder if it obligates China to like continue to, uh, behave at some level. Otherwise, they run the risk of losing because they are financing a lot of the U.S.'s debt. And so I wonder if there's some sort of a kind of a strategy to owe them so much money that they can't afford not to work with us.
You mean like, just like, I think I understood what you mean, but just for the listeners, because I think this was a little bit of finance speak that might have been
Yeah,
unclear. Can you
sure.
rephrase that?
Well, I mean, a lot of the U.S. debt. U.S. is a debtor nation right now, and a lot of that debt is financed by China. Right, they're our single biggest lender. And if we add 1.7 and another 3 trillion in new spending in the U.S., how much of that is coming from countries like China? And if China ends up funding even more of our debt, what can they afford to go to? Can they afford to go to war with us, or can they afford to be so competitive that they cripple us financially in some way so they don't get that money back? I don't know the answer to that. It's just sort of a
Yeah,
thought experiment that's going through my head.
for sure, for sure. To
Someone,
that, I
maybe
would,
one of your listeners can chime in and tell us whether I'm off base there.
yeah, because like for sure. By the way, please do.
Yeah.
Um, and like also, I'm thinking, what about the money printing? Because in that
Yeah.
sense, they're inflating away the debt, which is a
Yeah.
good thing if you're the debt
Yeah.
debt holder, I think is the right
Yeah.
word.
Right. That's right. Yep. Yep. The lender. Yeah. Yeah. Certainly. certainly and that brings in a whole other area, which I'm just not knowledgeable at all. And that is this whole cryptocurrency, world, and how that changes everything, that dynamic.
Mhm. This is going to be meta. This is going to be a first. So while doing a podcast, I'm advertising another podcast episode because number 13 just dropped, and it's with Gabriel Hines, and it's all about decentralized finance 101 for sort of non-crypto people intro. Yeah. So, feel free to listen to that one.
Oh, I will. I would learn from that. That'd be good. Yeah,
for sure. Actually, like one last thing I would want to talk about, switching gears one more time, is enterprise sales.
Yeah. Oh, good. Now, this is a topic I can actually talk with some experience on. Fire away, Gabriel.
So how the hell do you sell into huge corporations, hospitals, healthcare providers, from the outside in? Because I'm assuming this is like a very complex, long, kind of daunting process.
Well, it can be. There's so much to that question. I mean, first of all, you have to identify the opportunities and so forth. And oftentimes they come to you with that, and they say, hey, we have a problem, we're trying to solve blah, blah, blah. And or they discover you somehow through your marketing. But say you get a conversation going. In some cases, you're reaching out to them directly and saying, hey, I can help you, and here's how. And then from then, there's so much of it is, there are so many moving parts, there's so many people to talk to and so forth. But I think if I were to answer the question as simply as I could, it would be the thing you have to do at that point is, once you get the conversation going, it's a conversation around its discovery. It's understanding what their business is, understanding what their objectives are, what the obstacles to doing something in a new way, what's the implementation process, the onboarding process, all those sorts of things, and understanding at a kind of at a fundamental level, how might you be able to help solve their problem and work with them and be successful. And so it's an awfully big question, but I think ultimately it comes down to understanding, being able to ask a lot of important and kind of probing questions in a way that's revealing, and that's called the discovery process, and there's kind of a methodology around that. And I actually even have a series of documents, worksheets that you can download off the website that kind of help you think through all the questions and the steps and the discovery that you need to do in order to kind of get to the bottom of that.
Yeah, for sure. And we'll obviously link it below.
Yeah.
So if you are, because I'm just thinking, going back to the whole VC and starting out, as a founder, startups, etc.
Sure.
So if you're starting out, maybe even you have whatever, $500,000 in, seed funding, maybe you have some, startup accelerators, some, some background, but even then, if your customer is like a healthcare provider or, a huge hospital chain, how do you even get your foot in the door?
Well, that's kind of where I help startups, is like I kind of coach them on that. So what I do is I work on a kind of a retainer basis where I'm basically on call, and I coach them. We'll have a structured call, and then we'll have on ad hoc calls, whatever they need. But what I do is I kind of work with them to figure out how to get into accounts, and how to talk to the right people, and what to talk about, and what sorts of questions to ask, and so forth. And then, do you use cold email, or do you do, is there some sort of, like how do you get that initial conversation going? Are there introductions that can be made? All those sorts of things. And that's kind of what I work. That's kind of what I work on.
Okay. So in a way, is it fair to say that they're kind of like paying for your network for you to give them an introduction?
Not much, not really. The network isn't really the thing. I do, it's really more of like allowing them to become better at doing their own selling. And for founders, they have to do their own selling. They have to be engaged in the sales process because they have to hear what the customers want. They have to understand what the obstacles are. They have to understand the workflow and integration, and they have to understand the industry and the language, like what words you use to speak, all that sort of stuff. And then ultimately establish relationships with those people. Those are the customers they have to work with.
Yeah. Thank you for giving the the glimpse.
Oh, my pleasure, man. This has been great.
Especially with the sales, but also, the future of the world, healthcare, all that good stuff. This was a smorgasbord of topics.
Yeah.
And again, obviously we'll link it all below. And thank you again.
Gabriel, it was a pleasure. Thank you, man.
Thanks so much for listening. If you like the podcast, please subscribe and leave a review on iTunes or Spotify, and share the episode with someone you know. It would really help me out a ton. New podcast coming out every Monday. See you next week.